Good evening and welcome everybody to this presentation on restarting scouting, what you need to know, at least what you need to know at this particular time. So we're going to cover this the best way we can with the information that we have on, but as all of you know that the information regarding especially COVID-19 is changing always. My name is Kevin Nichols. I'm the Scout Executive for the Mount Baker Council, and I'm proud to represent the Mount Baker Council Executive Board and our Council Key 3, and especially our Risk Management Committee under the chair of Stan Pease. The Enterprise Risk Management Committee is our committee to overlook the safe scouting that we do as a group, both our units and the district and the council level. Tonight's presentation will have no chat bubble, as you can see, because of the number that we're expecting. We've always run into problems when we get too many people on, but the information will be available on a website, on our council website, that you will receive a link to soon, either probably tomorrow morning, that will have the information, including this recorded presentation and all the guiding documents that we've put together for your use. So there'll be all the information will be available to you. Again, I do want to make sure though that if you've got any questions tonight after tonight's presentation, which we assume are, please send them to the email address that's listed below here, and you'll see it throughout the presentation, to mbc606@scouting.org. Again, any questions you have. The questions you do have, what we will end up doing was we'll build what's called a frequently asked question list on that website, or FAQs, from your questions, so that we can answer those, and that you and others can refer back to those as you planned your safe activities when allowed for your scouts. I do want to acknowledge two individuals tonight who have done a fabulous job, the yeoman's work, to help put some of this presentation to there. They did a lot of the research on the documents, the guiding documents you'll find, as well as what we feel are recommendations that you can follow for when we're able to restart scouting safely. Rich Mueller, who is our chair of our Outdoor Adventures Committee, and Riley Suffrage, who's chair of our COPE and Climbing Committee, put in a lot of personal time and a lot of personal effort to help build this presentation. So it's my pleasure to work with those individuals, and again, our Risk Management Committee to put this together. So our objective with restarting scouting is to keep the scouting program available, accessible, and flexible through observing health and safety measures through an ever-changing health, medical, legal, social, and financial environment, as all of us has known. Just in the 3 months, really since almost 4 now, that we have been operating within the state of Washington and our local counties. So our goal is to always try to keep the scouting program available, whether it's in person or, like a lot of us are getting used to now, virtually. Now, of course, we are guided as scouts, all of us, scouts and scouters, by the Scout Oath and the Scout Law. And if you read the Scout Oath and Scout Law and live by it, as scouts and scouters, we all understand that we have a duty to our country to follow the rules. Also, it is our honor to be respectful, obedient, trustworthy, clean, and kind. So please remember those as we deal, especially with the COVID, and when working with our families and working with our neighbors and our community and those that are around us. We are scouts. We kind of show the way. One of the questions that we get quite a bit is, what about the insurance program from BSA? BSA provides a general liability insurance program that applies to all official scouting activities. Now, generally, a official scouting activity is an activity that is consistent with the values, our charter and bylaws, our rules and regulations, our operations manuals, and the literature of the BSA, and those that are not prohibited activities. And you can find that list of those usually on the websites at the scouting.org, also through Guide to Safe Scouting, but more information on that. And it also is primary for registered adult volunteers with the unit and, of course, our chartering organizations. The other insurance we have is that paid by the Mount Baker Council through the BSA's program. It's called the Accident and Sickness Insurance. Now, this is a secondary insurance to your own personal insurance, such as medical or prescription or other health insurance. But it is a great tool to have when helping out families who may need a little bit more with insurance programs resulting from a scouting program activity. Well, COVID facts as we know them now, and I know many folks here are quite aware of this, but of course, we do know that the virus information is being continually updated and ever evolving. We do know that the virus is so prevalent in our communities. We do know that the virus is highly potential danger to people every day, especially those that are considered high-risk individuals. And many infected are asymptomatic and pose a risk to the spread of virus. And references you can go to, again, this is being taped, and you can, if you can't copy it down, you can get these tomorrow, is at scouting.org/coronavirus, also the CDC.government website, as well as the Washington state government. All would probably have the latest information regarding the coronavirus. Again, if you have any questions anytime during this presentation, please send them to mbc606@scouting.org. Now, we talked earlier about higher risk individuals, and CDC has identified those individuals as being over the age of 65. Possibly they may suffer from chronic lung disease or asthma, may have serious heart conditions. Their immune system has been compromised, obesity, diabetes, kidney disease, and liver disease. Anytime we're talking about restarting scouting, that is a group that, especially our units and, when we were going to run summer camp, that we definitely was concerned and think of ways of how we could mitigate any chance or any potential chances of spreading or them getting the disease of COVID. Now, if some of you might be familiar with this picture from the state of Washington from its 4-phase program, the 4-phase approach. What I did want to give you what the status right now as of today for the counties within the Mount Baker Council where we do our scouting. Phase 2 is, the Phase 2 counties are San Juan, Snohomish, Skagit, and Whatcom. We do have one county, the Island County, that is in Phase 3. And there are different, different phase levels for each one of those. But as you know, right now, especially in Phase 2, the gatherings of people has to be either your household or no more with fewer than 5 people outside your household. But more information on that later down into the thing. But this is up today. Now, just wanted to briefly go over kind of what the Mount Baker Council, its executive board, and its Safe Start to Summer Camps and its Risk Management Committee have been working on throughout this time. Of course, in March, when the governor came and basically started the program of stay at home, the our initial response is to understand the situation and its risk, both legally and regulatory and insurance-wise. We also at that time, through our VP of program, Gary Hoffman, and several great volunteers at the council, district, and unit levels, put together and saw a need to create an opportunities for virtual scouting, and that's when we created this Scouting at Home committee in late March, early April. And hopefully you've been able to enjoy a lot of the programs, including our camp-in, the merit badges, now the DIM meetings online, the First Friday events we've been having this summer. So they did a lot of work and a lot of effort and a lot of man hours. We also at that time brought the employees into a work from home experience versus from the offices, because we shut down the offices to make sure that we fell within the phase 1. So our Bellingham employees and our Everett Service Center employees. And through it all, we continued our core operations of unit service and contacting our leaders during that time and trying to do some fundraising because, of course, like everything, scouting costs to provide. And so also we learned to adjust our technology. Of course, all of us seem to become experts now in Zoom type of meetings and that sort of thing. And that's what we learned in that initial response, March through May. And then what we've entered into, and just right now including, is what we call the monitoring phase, where May through July, we monitor developments, we monitor the state mandated phase levels, weigh the risks, the options, try to keep, ahead of the evolving guidelines, the possible mitigations, and also started thinking about what about the likely reemergence context. Again, focusing on trying to keep the scouting program, available, accessible, and flexible. We also had our BSA national group develop some directions and options. During the initial response and just recently through the monitoring phase, we also had created a Safe Start to Summer Camps committee that was working continuously to see if we could actually be able to run Fire Mountain Summer Camp for our Scouts BSA members, as well as the day camps that we're providing. But as you have obviously heard, the board had to make a decision based on the Skagit County recommendations from its health department that we wouldn't be able to run Scouts BSA at Fire Mountain this year. We also worked hand in hand with our local health departments, especially regarding Fire Mountain. And we started to build the communication tools that we need to make sure that our unit and our unit leaders were most up to date of the information we had. And then we're talking with August plus, August on to when we can, reemerge from this to relaunch scouting. We are continually looking at finalizing the plans for relaunching scouting, finalizing that support of our unit, our districts, and our council programs for restarting. We're going to continue our vigilance and make sure that we maintain the health and safety standards. We're going to continue those communications with you. And then we're also going to really focus on what is the risk potential monitoring of a potential second wave, as many of us heard through many of the CDC and many of the people from the White House down. So we're very active in trying to monitor and to also think about where we go from here. Now, what kind of resources do you have, and what do we have to restart scouting safely? This is, again, going to be recorded. This is also going to be on the website so that you can download these anytime. But the BSA resources right now is, and we'll cover it a little bit later in the next slide, is the Restart Scouting Checklist, or what they call the SAFE checklist. Important document for units and in districts to utilize when they're thinking about when we're allowed to safely begin meeting in person. So the restart scouting checklist. Other documents that you'll be able, from these guiding documents, you'll be able to download from the website is the model pre-event medical screening checklist. And I see that we have a spelling error there, but it's the model pre-event medical screening checklist. Also something called the pre-event medical screening checklist. We'll cover that a little bit when to use those appropriately later on. We also have National's Prevention of Communicable Diseases in Scouting, which is actually produced before COVID came along. Also an important one is units should also be making sure that they have the most up-to-date annual health and medical records, Part A and B, so that they're aware of any medical issues with their scouts and scouters. A absolutely great tool is the Guide to Safe Scouting, which is online on our national websites. There's an online version, and you also can download one that you can print. Also, a BSA resource, and I want to make sure that every unit make sure that they understand this. If you do have an incident, any type of incident on a camp out or a unit meeting, and this could include that you become aware that somebody has, got COVID from potentially a scouting meeting or, an event. Then we want you to go to the national website, which is scouting.org/health and safety/incident report. And please report that incident so that we are aware, so that then we can go into action with that. We're going to talk a little bit later. One of the helpful tools is to make sure that you've got rosters for when you do any events, when we safely start scouting, to make sure you have activity rosters of everybody there so that we can do contact tracing if something like this happens. So those are the BSA resources. Now, of course, the government has many resources, including the CDC, and the ones that we're going to have on our website for you to download are three, I think, good ones to share among your families and your scouts. Is one's called How to Protect Yourself and Others, Stop the Spread of Germs, and then How to Wash Your Hands. Those are good infographics that you download and can share. Also to look at the state of Washington coronavirus website, and another one that I personally we worked with and they were great, helpful especially when we were working with them on summer camp this year. It was our local county health departments, and they are an excellent tool and an excellent website to check out. So these are excellent resources for you to know about, to use, to utilize when you start meeting safely. Now, the Safe Restart Checklist, great tool. It's a 2-page tool from our national organization. And what I wanted to highlight was what SAFE actually meant. And the first thing is supervision. And the key thing is check mark is to understand your local and state guidance on preventing COVID exposure. And we're gonna really push that. Make sure you understand where you're sitting at with the phase level in the state of Washington, as well as your local community, as well as the local county health department. Those are the key resources on whether you can decide whether you can safely start a scouting program or a scouting activity. Also, you need to engage your charter partner as well as your local council if they've had any necessary adjustments, but especially your charter organization. You should be following their protocols anytime that you're getting ready to open any scouting functions safely. Also, conduct the quote-unquote before you gather protocols, and you'll find out more in the full checklist. Second one is assessment. Identify those who are in higher risk, and notify the participants that about the risk of participating, because exposure cannot be eliminated. There's always that potential. Verify the planned activity, the gathering of group sizes are not prohibited by local and state orders, and you'll find those in the phase levels. Fitness and skill. Review the annual health and medical records. So make sure that you get the updated one, and you'll use that model pre-event screening to help you with that. Equipment and environment. Verify that hand washing, hygiene, and cleaning supplies are available and used properly. Monitor social distancing, interactions, and sharing of equipment and food. I will also add to that. Remember, in the state of Washington, there is a governor's decree on the use of face coverings, face masks. So make sure we'll remind you about that as well. Monitor your participants for changing health conditions, and then also use as you gather protocols. This is an extremely useful tool. Probably you can base a lot of your decision makings on this, as well as the local and state guidelines. I want to definitely a shout out to Rich Mueller and Riley Suffrage. Definitely these next what we call the key three steps, the 3 S's. This is our recommendation to our units in our district and our council committees to really follow as we think about bringing back scouting programs safely. And those 3 are screening, social distancing, and sanitation. I'll say it the easy way. Again, reminder, always follow state policies. Find out what your county's phase level is and your local county health department rules, as well as, again, obtain your charter partners' protocols and permissions. If you're with a particular group, let's say you're chartered by a church, and the church has already established that there's going to be no meetings during this particular phase of this size of group, as a charter-owned unit, then you need to reach out to your charter organization representative and make sure that you're within the steps of their protocols and also have their permissions. Again, that's a good reason to have a good relationship with your charter organization representative and make sure that they are working directly with you and hopefully coming to your unit committee meetings. Under screening, again, reminder, identify the participants who fall under the CDC's group of high-risk individuals. And again, notify all participants about the risk of participating since COVID-19 exposure cannot be eliminated. The recommendation is that please use the BSA resources that we talked about earlier. The model pre-event medical screening checklist, the pre-event medical screening checklist, and the prevention of communicable diseases and scouting documents. Again, these guiding documents are going to be on the website that you'll receive a link to, and it should be available to you tomorrow, as well as a recorded version and a downloadable version of this presentation. The next screening, pre-screening. Before you do attend an activity, scouts and families must, definitely should determine their own health before participation. Are they at high risk? Remember the list. Are they feeling well? Have they been exposed? Are they aware of that? Are they prepared to follow the activity safety guidelines? And activity screening to be done at the beginning of each activity. Review the pre-screening at the activity as well. Just a case in point for this, when we were planning on doing summer camp, we were going to ask our units to do some pre-screening before they left to go to camp, and then when they arrived at camp, we were going to do the same pre-screening with them. So think about that as we start when we get ready to start scouting safely. Think about that as a pre-screening before and pre-screening as you start your activity. Just a reminder, and I haven't mentioned it away, please, any questions you have tonight, send them to mbc606@scouting.org. And again, this presentation is being recorded, and you can capture that email. So, and we'll be monitoring that for any potential frequently asked questions that we can answer and put up on our website. Thank you for making that happen. Screening, and those at high risk for infection definitely should consult a physician prior to any participation in any group activities. They should take a look at review their current health prior to participation. Only those who are feeling well, this is for everybody, only those feeling well should participate. And whenever possible, temperature checks of scouts and leaders should be made prior to participation. All units should produce a detailed roster of participants for all meetings and activities, so they are prepared in the event that contact tracing is required. And just remember back several slides ago, we talked about one of the resources was the national website, the health and safety website, where if an incident that you know that COVID did come into play, we want you to fill in an incident report. If there's any confusion on that, you can always contact the Everett Service Center, the Bellingham Service Center, your district executive, and they can help you with that report. And all those who've been exposed to coronavirus must quarantine for 14 days prior to any participating in any scouting activity. Social distancing. There, of course, is no substitute for 6 feet distancing for non-family members. Now, families and siblings, household members, do not need to maintain social distancing for transport, sleeping, or meeting. Now, pre-planning activities needs to ensure that we have social distancing. You know, how is the space going to be used to ensure social distancing? Have you took a look at your facility? Will that enable it? Do you need to adjust? Do you need to, if the weather's outside, good outside, maybe it needs to be outside instead of someplace. How are those people getting to that activity? Now, again, family members, siblings can ride together, but you need to take a look at the phase level to see whether people can ride together. Will face masks be required? This one, I definitely want to say follow the state policy, and as you know, there is a policy right now with regard to using face coverings outdoors, especially you can't go in the store right now without having a face covering. So make sure that everybody's aware of that policy and that the face masks are appropriate. And is your group size conducive to social distancing? If you focus on those 4 questions, you should be able to, when we start safely, to ensure that social distancing is happening. Also, you need to follow, follow your discipline. Create a social distancing culture among your group. I imagine most of you are doing that, at work or at churches or with your families. Also, treat social distancing infractions directly and seriously. Especially with working with families and parents and scouts. Make sure that they need to understand why the rules are in place to protect all others. And remember, Scout Oath Law, we help all other people at all times. Groups, again, must always maintain social distancing 6 feet, including hiking, biking, and other activities. Transportation to and from activities should be made within family units. No carpooling is allowed. When mandated and practical, each scout and adult should wear a face mask. Again, go back to the state rules. If your county status is phase 1 or phase 2, currently you are limited to essential travel only and limited non-essential travel within the proximity of your home. So take a look at phase 2, and we'll cover a little bit of that. That is the rule for phase 2. It's limited non-essential traveling within proximity of your home. That is right out from the Washington State Phase Approach Plan. Being sanitaries, again, we've heard from the very first, and it's still a guideline that wash your hands with soap and water for 20 seconds. Many scouts have learned to say the scout oath and the scout law during that time. It's a great teaching tool for them to remember the scout oath and scout law. Have 60% alcohol sanitizer available. But remember, this is flammable, so keep it away from heat or open flames. We do have a recommendation from health departments and others on bleach solution, 1,000 parts per million for surfaces that can handle it. And if you're not using a clean tablecloths or coverings that can be bleached, the ratio is usually a third cup of bleach per gallon, but that only lasts for 24 hours. Then you have to make some more. And hand washing and sanitation of shared supplies must be done between uses. So if you're having an activity and a group of kids are at a table and then they're moving to another table, another group of kids is coming in to do an activity, you need to build in some time and make sure that hand washing has occurred and that you sanitize all the shared supplies and the table itself. Reminder, send any questions that you have to mbc606@scouting.org for our FAQ. Now, a reminder of the Washington phase level programs, that approach that we are. If you remember, phase 1 was shelter in place, and families are allowed interaction and no other actions without social distancing. Now, in phase 2, which is right now, we have the 4 counties, San Juan, Snohomish, Skagit, and Whatcom, are now in phase 2. Gather with no more than 5 people outside your household per week. This is outside your household. Now, we are interpreting that is that one person can be with 4 other people outside their household. Now, your household, if you've got 5, 8, let's say 12 that live in your household, households can go camp, go to the beach, etc. And all outdoor activities involving fewer than 5 people outside your household. Remember, involving fewer than 5 people outside your household, camping and beach. So if you're one person, you can be with 4 other people. That's how many are interpreting that. Again, check your, the state requirements and check your local county health department requirements on these phases. Phase 3. During phase 3, groups of 50 are allowed indoors and outdoors. Non-essential traveling will be allowed. Outdoor group camping may be allowed. Again, see county rules. Pools, bowling alleys, and other venues start to open. But again, with everything, as we talked about, social distancing of 6 feet must still be maintained. Phase 4, which we're all anticipating we'll get to that. Resume public interactions with physical distancing. Groups of 50 or more allowed, and outdoor recreation allowed. Camping, at Fire Mountain as a group again. So again, monitor the state and its phases and see where your county is. If you're in phase 2, remember you're limited to the proximity of your house on any travel. Reminder on the charter organization approval. The unit leadership must have an interaction with their charter organization leadership. Your COR as we call it. Especially prior to any restarting of any activities in scouting, to review any procedures or protocol changes that the charter partner may have, and make sure it'd be helpful to gain the written approval from your charter organization. This includes any activities you may do at the charter organization facilities, as well as any outdoor activities. Remember, the unit belongs to the charter partners, and all programs need to have their approval. That's the responsibility of the charter organization representative. Now we have some recommendations. Again, just want to remind everybody, this is just recommendations that based on what we are interpreting somewhat from the phases, but again, the key thing is to relook at the phases, check with your charter partner, and look at what the county health departments are doing. Phase 1 for den and patrol meetings virtually, only for all individual. Phase 2 may be virtual only for high-risk individuals. But if they do something outdoors only, you must have 6 feet social distancing between non-family members. You must wear a face mask when required by the state. It's limited to 5 individuals, as we talked about earlier. So 2 adults and maybe 3 youth, or a household, but not intermixing that way. Can't have 5 people from a household and 5 individuals. Must record attendance and report that to the unit leader. No carpooling. Local destinations only, and must use the restarting scouting checklist, the SAFE checklist that we used earlier. So these are some recommendations, and it is based on how comfortable your scouts and your family members are as well. So we see a lot of people still just doing virtually, which is perfectly fine. Phase 3, when we get into for den and patrol meetings, is virtual only for high-risk individuals. Again, same thing, 6 feet distancing, face masks, recorded attendance, no carpooling. Now, groups can be limited to 10 or less scouts with a minimum of 2 registered adults at all times. Remember that. And it's recommended that groups of scouts and parents should be in groups of 5 youth and up to 5 adults. And must use the restarting scout list. Now that's for phase 3, and remember we only have 1 county right now, so basically in phase 3, and that's Island. And phase 4, it's when we get to a point where it's recommended of all that we can start meeting as a group, but to sure we need to still record the attendance, report to the unit leader, use this restarting scouting checklist. And then make sure that you're also doing physical distancing, mindful of the state, again, in the face mask rules. And also, with all these den and patrol meetings, we'll cover a couple others, is if an incident does happen of COVID, again, a reminder, you must report that as soon as possible to the incident reporting procedure that we covered earlier. Again, you'll be able to get this off our website later. Unit meetings during these phases. Phase 1 is all for individuals. Again, phase 2 for all individuals. Phase 3, virtual for high risk, but limited to 50 people. So if you have a pack that's got 80 people plus the parents, right, then you're going to have to find ways that maybe you do 2 or 3 meetings and divide up, those people. Again, you need to follow all the safe social distancing rules, face mask, and attendance checklist. And then when we get into phase 4, recommended for all that unit meetings can happen. But again, we need to be vigilant to make sure that we are staying as safe as possible. And, again, phase 4 says resume public interactions with physical distancing. Now, we get a lot of questions on camping and backpacking during these phases. What's happened? Of course, phase 1, no, not permitted. Phase 2, family only, if permitted in the county of residence. And why we say that? Because if you remember, you're supposed to stay a limited non-essential travel within proximity of your home. Phase 3, not recommended for high-risk individuals. Again, social distancing among non-family members when hiking, biking. Again, face masks, attendance, no carpooling. Groups should be limited to 10 or less scouts with a minimum of 2 registered adults. And again, the Cub Scout and parents 5 and 5. No group cooking recommended. Individual or family group cooking only is the recommended there. Again, you have to also be aware that if you got people using same equipment, you would run into dangers of potentially spreading COVID. More in phase 3, tents should be no closer than 6 feet, just like in social distancing. Individual or family group tents only. Use the checklist from the Restart Scouting. And we recommend that each individual take their own temperature daily with a digital thermometer. And then phase 4, recommended for all, again with physical distancing as according to for high risk individuals. Now we also put together some additional resources, that you can as well as go, and that's through the CDC, both for prevention, high risk, gets in a safe start, backcountry plans from the National Outdoor Leadership, group, as well as a backcountry video, and leave no trace for possible resources as you may plan camping and backcountry experiences. Well, thank you for listening tonight, to the presentation. Remember, our objective is to keep scouting programs flexible, accessible, and that we need to be, as scouts, follow the rules as according that we would do from the Scout and Scout law. We need to be trustworthy. We need to be clean, kind, and obedient. And we hope that these tools, these recommendations will be helpful to you as you plan on. We also find that hopefully that you'll find the website that you'll be receiving a link to tomorrow, along with which would include the guiding documents that you can download, will be helpful. Now, what would be helpful for us, because of the largeness of our group tonight, is to please send any questions that you have to mbc606@scouting.org. We hope that we can build FAQs and share your questions and our answers with those who might not have been able to be here on tonight and can go to that website and download and be that helpful. Now, I want to again thank our risk management committee under the leadership of Stan Pease. I want to thank Rich Mueller and Riley Suffrage for all their work to put this together for all of us to follow. And I want to thank each and one of you tonight, as well as your fellow scouters and unit leaders. Thank you for what you've done in the past for our youth. Thank you for what you're doing now through all this with COVID for our scouts today. But most of all, when we get back to serving scouts, I want to thank you for reaching out and thinking about the future of scouting, the future scouts that will involve, as well as the current scouts, as they learn and benefit from this life-changing experience that they're going to get nowhere else. Thank you for doing that. Thank you for being part of this. And thank you for listening tonight. And scout on. Thank you, Scouters. This ends our presentation tonight.